Hi, I'm Sharrie Harlin-Davis, program host for Reid Beside You. Thanks for joining us. And today our guests are our midwife, our certified nurse midwife from Reid Health. And welcome, ladies. And first of all, I would like for each of you to introduce yourselves. We're going to start with Jane. And tell us a little how you came to Reid and your background.
So I'm Jane Woodward, and I'm a certified nurse midwife. I began my journey into midwifery and into Reid through 12 years of nursing experience. So I was a bedside nurse in pediatrics and emergency care, and then labor and delivery and postpartum prior to becoming a midwife last year and then joining Reid.
Well, thank you. And Roberta?
Hi, I'm Roberta Patterson. I'm also a certified nurse midwife, of course. I've been with Reid Hospital since 1999 as a nurse. Went back to school, got my master's degree in nurse midwifery in 2018, and I've been here at Reid OBGYN since that time.
Okay. And Caitlin?
Hi there, I'm Caitlin Jones. I am also a certified nurse midwife. I have a background in labor and delivery nursing in Ohio for 8 years. And I also went back and graduated from the University of Cincinnati last year amidst the pandemic. And I was hired on in August along with Jane, and I've been here since then.
Well, great, and we welcome you all to Reid Beside You. And first, what is a midwife? And either of you can answer that question.
A midwife in our context, again, we are all certified nurse midwives. We hold master's degrees in nurse midwifery. And again, all of us have labor and delivery background experience at the bedside. We are board certified by the AMCB, the American Midwifery Certification Board, and we take boards once we graduate.
And are midwives only for women who are pregnant?
I can take that one.
Okay.
And the answer is no, they are not. So we are trained to take care of women once menstrual cycles start around puberty, all the way through reproductive years, of course, childbirth, pregnancy, and then postpartum period, as well as beyond, and even after menopause.
And that's something new, because I always assumed, and just that being a layperson, we only heard, a lot of times you only hear of midwives with labor and delivery. So
I think that's a big misconception, and people don't realize all of the wide range of women that we can see and care for, as well as the wide range of services that we offer.
And on those services, what are some of the services that you provide? Aside from like the GYN exams that people are and including pap smears.
I can talk about that one.
Okay.
So of course, annual exams, which would include pap smear when they're due. We see patients for problem visits, if they're having abnormal bleeding, pelvic pain, a wide variety of issues, preconception counseling, contraception or birth control. Also, of course, prenatal care when they're pregnant, postpartum care. We see patients for lactation visits. What else? STI treatment, infections. There's a wide range of services we offer. I think some of the misconception about midwives is they think that, of course, we just deliver babies. But when I was in school, one of my instructors had told me, a midwife is kind of like an OBGYN nurse practitioner or like a women's health nurse practitioner. I think sometimes when you explain it that way, people understand it a little bit easier.
That's very enlightening. So if you see a midwife, what can I expect? Aside from those services, like how long would an appointment be?
We do tend to have longer appointment times because we have fewer demands on our time compared to the OBGYNs. So we I think all of us have a approach that where we will spend extra time with our patients. We will make sure that we answer questions that they might have in a way that they understand, because we're not being pulled in different directions. Our focus tends to be more exactly who we're seeing at that moment. Our approach is that we generally view, going back to pregnancy and childbirth, we generally view things as normal until they're not normal. And kind of the same thing with GYN care. We assume everything is normal, but we're trained to recognize when it's not. And we're a great starting point to refer those more complicated patients on to the physicians.
That's great. And you kind of gave us an idea on how midwives are different from the doctors. And that time thing really stands out. So we know that the midwives are not doctors, and you're advanced practice nurses. And but your can we discuss it a little bit more on your focus and training?
So I can start with that one at least.
Okay.
So like Caitlin said, we are trained to recognize the normal and treat the normal as far as for GYN concerns and pregnancy. And one of the focus points, I think, for midwifery is that we focus a lot on empowering women and educating women about their own bodies and kind of taking charge of their health care. So instead of, having someone tell you what you need to do, it's really about empowering them to kind of take charge and be informed about their body and be part of decision making for, whatever the issue is, whatever we're seeing them for. So I think that's a big difference. And our longer appointment times allow for that, that extra kind of education and getting to that different level of understanding. I draw a lot of diagrams and I'm not a very good artist, but just kind of getting that, that understanding of your body and giving that to women, I think is a great approach. And I think we all do that.
So you follow the same national standards for ultrasounds, any kind of testing. Is that correct?
That is correct. We have access to the same types of databases and evidence-based care with protocols and procedures that the physicians do, and we do follow those same guidelines and recommendations.
And then share with me some of the benefits of having a midwife for your pregnancy as well as during birth.
Midwives have higher rates of vaginal births, lower C-section rates, obviously, less complications with deliveries, lower rates of postpartum depression. Our patients have higher breastfeeding rates than other patients. I feel like you have that relationship with your provider, and not that this is across the board, but we tend to have a more personal relationship with our patients. Labor support is provided typically throughout their labor and delivery.
It sounds like especially the relationship part within anything, a relationship is so crucial. Did either one of you Jane or Caitlin want to add to that?
Once again, we tend to see low risk patients. So they're, generally otherwise healthy. They're just pregnant. If any complications arise either at the beginning or throughout the pregnancy or even throughout the labor itself, we're trained to recognize those abnormalities and intervene appropriately. We do tend to attract, again, low risk women. We also tend to attract patients who are more interested in an unmedicated childbirth experience, fewer interventions. Again, our approach is that, birth is a physiological event. It's a natural event. It's a part of our normal life cycle. And we treat it as such until we realize that we can't.
So what if I develop a complication during the pregnancy or the birth?
So we work closely with the physicians in our practice. So there are the three of us, and then there are 5 OBGYNs. And so we have meetings where we kind of review our patients and go over, any risk factors or concerns that are coming up, as well as just talking to them one-on-one if something comes up. And they're great at giving us input and suggestions. Sometimes it may mean, ordering an additional test. Sometimes it may mean referring them to the physician care for the remainder of the pregnancy or the birth.
Well, I would see that because they've developed such a relationship with the midwife that will you still stay involved in that case, or how's that work?
We
I think it
definitely
kind
do.
of- Oh, sorry, Caitlin, go ahead.
I was just going to say, we definitely do stay involved as much as possible. A lot of times, if there are some things that are starting to look a little unusual, but still overall reassuring, we will co-manage, and we will kind of, all three of us, the physician, ourselves, and the patient, will all come up with a plan together that still meets the goals that need to be met. In case a patient needs to go back for a C-section, for example, because something went wrong during labor, we are trained to assist in those C-sections and still be a part of the birth process in that way as well.
And we know that your top priority is always having a healthy mother and a healthy baby. So that sounds great. And when you were saying do midwives do cesareans sections?
We do not, because we none of us are trained surgeons. Those are
Okay.
our physician partners. But like Caitlin said, we are all trained to assist them in the operating room. So if we have a patient who goes there kind of unexpectedly, then we can follow them and still be a part of their care.
And
And-
once again, I just want to reiterate that normally with midwife care, normally the C-section rate is very low.
Yes.
And what about, can I have an epidural if I have a midwife?
Absolutely. Absolutely. If that becomes your choice, if that becomes the next right thing during your labor course, then that is absolutely something we will support.
Because you did mention that normally that a great percentage of people that you're working with prefer a natural childbirth, but just in case, that's always an option.
Absolutely.
As also, how is a person supported if they want an unmedicated birth?
Back to the, we have fewer demands on our time, so we are more available to be present during the actual labor process. We offer that one-on-one support that is kind of unique to us. We are trained in position changes, targeted position changes, even based on the station of the baby, the presentation, which way the baby seems like they're facing, and we can cater our interventions to help bring on, stronger contractions, bring on progress in labor, and we're trained to support that natural birth process.
So, always, this is a little unexpected, but do any of you have just a really great success story you could share? No names, just a great experience. I'll get back to that one. So, or just if a person was a little frightened, and then how you had worked with them. So that's, we can always get back to that question. So do midwives ever induce labor?
We do induce labor. There are certain medical conditions that would indicate the need for induction. Sometimes it's a patient's personal preference, and we try to work with that patient to make that experience how they would like for that to go. Back to your other question about, a specific situation, I can think of so many special situations with patients and things that we've done. I can think of patients delivering, squatting beside the bed because that's what they wanted, or you think that a patient's not going to make it to have a vaginal birth, and then you turn them a certain way and you put them, in hands and knees, and then they are able to have their vaginal delivery when everyone else is thinking they're going to have a C-section. All those things come to my mind. I'm sure it does for the other ladies as well.
Yes, and I think with Roberta too, since she has been here the longest, she's now delivering, women in subsequent pregnancies. So I think that's a really fun, special thing too, is that you do build such a great relationship, and then over time you're seeing these women have more babies, and that's a really fun thing to be a part of.
So are they requesting you, Roberta?
Absolutely.
I get a lot of requests for Roberta.
Oh, great.
That's good to hear.
What about home births?
So there are midwives that do home births. It's a little bit confusing in the public. There are different types of midwives and the laws are different by state, but the three of us here at Reid do not do home births.
Okay. And because it looks like you all have had a passion, had been either an OBGYN or pediatrics, I'm going to ask each one of you, what made you decide to go into midwifery, to become a midwife?
For me, I feel like that middle piece, that piece where we really take into consideration the patient's wishes, the mother's wishes. We are able to kind of bridge the gap between normal care and obstetrical care, because we offer that middle piece to where we really have more time to partner with them. We really have more time to come up with a plan for them that works for them, that takes into account their desires. We practice active ongoing consent to make sure that they are fully involved and consenting actively in whatever we happen to be doing. And we really, again, have just more time available to us because we're not surgeons. We aren't being pulled in different directions. We're able to provide that one-on-one support that traditional obstetrical care can't always provide due to no fault of its own. But we just have a more narrow focus, and we're able to kind of really get in there and focus on the patient and her birth story. I wanted to become a midwife because I wanted to be that. I wanted to be that middle ground. I wanted to attend the whole labor process and then still attend the delivery at the very end.
And next?
So I became a midwife when really through the process of having my own children. So I had a midwife, and at first I didn't even know what a midwife was, and I had such a great experience. And she really just empowered me and educated me and just believed in me the entire time. And I had a beautiful birth. And I just, from that moment on, it just sparked an interest in me that this is something that all women should have available to them. And that's kind of what eventually, 3 kids later and lots of schooling and time in between, landed me at this point.
Okay, now we're going to talk to the pro. Roberta?
Oh gosh, I don't know what else I would have done. I feel like this is just what I was meant to be. I always loved pregnancy and birth. I probably would have had 8 children myself if I could have stayed home and raised them all. But I think just all the years of labor and delivery, nursing, I considered going into family care, and then I really didn't have a whole lot of interest in being so broadly focused, and knew in my heart that I really wanted to stay in maternal child health. So then I just made the decision to go on with midwifery. And I know there was no other path, really. This was my calling.
It sounds like that. And are all of you accepting new patients?
Absolutely.
Yes.
And where locations? Are you at certain locations, but just work out of the main hospital? Are you in maybe our Fayette office or Eden, or where do you?
All 3 of us, our home base kind of
Okay.
is still in Richmond at the main OBGYN office there next to the hospital. But we are starting to do some outreach locations. I think Roberta and myself will go to Cambridge City, which is about 20 miles or so further I guess, west from Richmond. Jane and I are going to be at the Eaton office, which is actually in Ohio, which is, of course, a little further back east to come to be more available to that clientele. And then, Roberta, was there somewhere else that you were going to?
We were in Hagerstown, but I don't think we're going there anymore. But I think eventually next year we will try to reach out to Randolph County, to Winchester, hopefully.
And I'm also in Connorsville as well.
Okay. And will your insurance? What about insurance? That tricky word. Will insurance allow you to see a midwife? And I might take that from you.
As far as I know,
live in
we're
the
accepted
insurance
by all
world.
major insurances that are otherwise accepted at our offices anyway.
Okay. Just because now the midwife care is covered by insurance companies, so both private and public. So any doctor or nurse practitioner could come to Reid for that. And
Correct. And we are licensed technically as a nurse practitioner. So we kind of fall under that same umbrella, just like if you saw a nurse practitioner at any office.
okay. What is the most updated way of looking into that midwives are now accepted at Reid? How would you like to share with our audience? Because at one point we had a lot of rules, and it was, you're going to have a baby this way, and this is it. But it's so enlightening that we have a lot of options, and that mothers can choose how to have a baby and have that baby at Reid. So
I think it reflects the public demand for more options, for in a way, declining or maybe taking a second look at some of the traditional models of care that we have in obstetrical care. So I think Reid is doing a great service to the community by bringing us in and offering that together. I think we have so much potential, the three of us, and there may be even a fourth eventually. We work really well together. Our strengths work really well together, where someone may have a area of improvement, the next one has a strength in that area, and we work really well together. And I think we're really aimed towards meeting the demand of the community for more options in their childbirth experience.
that's great. And what if I still have questions? How do I get in touch with, get a consultation or an appointment?
You can call and set up a visit at any of the locations where we see patients, and for a consultation visit, or if there is anything that any kind of problem visit that you need, you can schedule an appointment for anything to see us.
Okay. And is there anything that each of you would like to share on, just so our guest would know, on the added benefits of coming to have a midwife and their pregnancy?
I think the word midwife actually means with woman, and I think that encompasses exactly kind of what our focus and our mentality is. So it's not, it really is a partnership, and I think that is the goal with all of our care that we provide.
That sounds great. And was there anything else from Caitlin or Roberta that you would just like people to know, just to maybe debunk a misconception? Well, we've covered it. So
I think we've mostly covered it. I think our focus is just being a partner. We're not going to, tell you exactly what to do. We're not going to say you have to do this necessarily. We'll say, these are our guidelines. These are what we recommend. But, from my perspective, consent implies the option to say no. That's what educated informed consent is. And while we're certainly going to guide you a certain way to make sure that everything is safe, we make sure that we are making partnership decisions and that you understand the why really well on what we're recommending if we happen to recommend anything.
Okay. Well, if we don't have any other questions, we want to thank the midwives from Reid Health for joining us and thank our viewers for watching this episode of Reid Beside You.